Welcome to Pride in Parsippany. I'm your host, Mayor James Barberio. Today, my guest is Carlo Dilizia, the Parsippany Health Officer. Welcome, Carlo.
How are you, sir?
Yeah, how you doing? Good?
Good. Happy to be here.
Well, please, if you can give us a little background about yourself and,
Sure.
before I start questioning you, it'd be great.
Wow, I've been in the field for nearly 22 years. Started at the Township of Parsippany, I think it was late 94, 95. I have a degree in community health services. I also have a master's degree in environmental health, and currently employed as the health officer of the Township of Parsippany. But you utilize me through a shared services agreement with East Hanover Township. Right. So it's been there's a cost benefit as well to both municipalities, and trying adhering to that 2% cap. Again, it's been mutually beneficial to both communities.
Right, like Carlos said, at the township, we have a shared service agreement with East Hanover. And it's been very successful. So
Yeah.
I have to say it's worked out very well for us and for East Hanover as well.
Yes.
What exactly does the health department do in Parsippany? Can you just explain that to our residents?
We're going to need more than a few minutes to discuss that. There's a variety of services, and I'll do my best to try to explain them to the best of my ability. I mean, we can start out from the, we are housed under the Department of Health and Human Services, which is under Michelle Bacone, who's an unbelievable boss. It's not easy running such a large building there with a lot of moving parts. Under our environmental component, we handle a lot of compliance measures with the retail community, so it's the food establishments. You also have your campgrounds, your public recreational bathing. We also have a nursing division that handles all of our communicable disease investigations. There's a ton of disease investigations that are done. They also handle the immunization audits throughout the schools. And there are a variety of child and or adult programs that we run. Let's start with the children as well. We provide a child health conference for families that are in need, that need it. And we also run a variety of programs for our senior citizens, ranging from just basic blood pressure to a variety of diagnostic or clinical programs, from a melanoma screening. We have our podiatry clinic and so on, and they are all listed on our website. So
I got to tell you, that's one thing. A lot of towns will say, a lot of mayors, that's one benefit Parsippany has.
Yes.
We have a community center, a human health and services. We have a health office. We are like a one-stop shop.
Yes.
And I know I love going there, senior citizens, and I'm glad that some take advantage of it. It's there, it's there.
Yeah, they do, and it's amazing. Every once in a while, we'll get some seniors that do come in, and we take them on the tour, and then they're like, wow, they didn't realize that building was there. We're like, how do you not? But once we do get them in there, slowly but surely, as we introduce them to all the programs, as well as some of the clubs, the social clubs that are there as well. It's great. It's great to see them. It's great to see their faces in the morning. More often than not, I'm an early bird, so when I'm there, they're usually waiting for the doors to open just to get in there early to have their cup of tea. It's quite amusing.
So how's the information that you get, because I know you probably get a lot of information, you share amongst other public health partners, protect the community?
Sure. Most of our information gathering, we like to say it's top down. So I mean, for the most part, if we get any federal recall notices, we'll start from the retail community, the food community as well. If there's certain recalls that are required for us to do some action, some administrative action, we'll get that almost in real time through a specific type of portal that only the public health family, so to speak, has access to. And then we have a system where we can get that out to the specific sites that may carry such a product. And it could be something ranging from a mislabeling issue to actually something that requires, a true contamination where, for the most part, it's providing assurances to the community that they're, that product is not being sold. From a disease investigation standpoint, again, we do have another type of portal system. It's a communicable disease reporting system where we get information pretty much on real time, and being that depending on the type of disease, it's something where I would even get something through my phone, for example. It's an alert which prompts me to go into the portal to take a look and see. It involves a lot of moving parts, specifically the hospital systems, our local physicians as well. those types of diseases are pretty much where that resident resides. So now you have a large, unique, and dynamic community in the Parsippany-Troy Hills region, so to speak. It makes for a busy day, and that's where our nurses, who are just an unbelievable asset, collaborate with the physicians, with the hospitals, with our state epidemiologist to try to ascertain information and make sure that we're protecting the public as a whole.
So can you tell us about foodborne illnesses, the role of the health department?
Okay.
We were talking, I know.
Yeah, that's actually a great, nice little segue there regarding from a foodborne illness standpoint. We investigate any alleged foodborne illnesses, whether it ranges from a resident basically saying that they ate at a specific facility and they became ill at a certain time frame. There is a boilerplate Q&A that we have to ask them in order for us to further investigate. Sometimes we get it from the resident. Most of the time we actually get it from a physician's office where there's true analytical assessments, whether it's a laboratory analysis or actually whether it's blood sample, stool sample, and so on, and we're able to kind of pinpoint that back to a specific facility and or a specific type of food. There's a lot of investigation that is involved with regards to alleged foodborne illnesses and or outbreaks. If it's an outbreak, again, the key is having the collaboration and the consensus and the communication between all the levels of entities, so to speak, within.
So then, basically, you encourage residents to contact you in any
Absolutely.
type of situation.
At any time, 973-263-7160. Please give us a call.
What is the most common? I mean, foodborne illness that goes through the office.
Well, you have. It does vary, but you are looking at typically you have Campylobacter, Salmonella, E. coli, which are kind of like your top three. Then you have what they call like an enterovirus, which can be similar to like what we call like a stomach bug. You get that a lot with facilities or sites that have a lot of not necessarily enclosures, where you have a mass of people, whether it's a school system, whether it's a daycare center, and or an assisted living facility. So we're required to provide line lists to the county, provide assurances to the people that are living within that area. Let's say if it's an assisted living facility, that they're doing the appropriate environmental interventions, and most importantly, that they have sought medical attention and are adhering to that medical advice.
And how do you diagnose like if it's meat, if it's chicken, or say something like that? How do you?
It's again, it's science based.
Right.
It does vary from disease to disease. So I mean, for example, let's just say you have. We'll use E. coli for example. I mean, typically everyone talks about ground beef, whether it's undercooked and so on. We just try to provide assurances that wherever that product is cooked, whether it's in the retail community or sometimes we get these communicable diseases that have occurred at home. And that's something that we'll probably talk about later on with regards to safe food handling at home as well. We just want to make sure that the product is properly cooked, cooled, and or reheated. But for the most part, as we're given that information, we want to make sure that that product is not being used. We might actually take that product to submit it to our state laboratory for analysis. And if you combine that, whether it's an isolated incident or you have a larger incident where you have multiple jurisdictions or multiple people that have a common source, where it is, whether it's a retail community or it was at a party, then you can kind of conclude that it probably is an outbreak, and then there's certain outbreak measures that you have to take.
Okay. And I might as well lead into this. What safety tips would you give to residents? I know we talked just previously.
Yes. Well, I mean, it's one of my favorite times of year, which is barbecuing. I barbecue all year round, even in the winter. My wife thinks I have issues with being out there in the snow, but everybody likes to have the parties outdoors. Everybody brings product in. Just do your best to make sure that, and it seems so kind of corny and cliche that keep hot foods hot and cold foods cold. Once you have all of these larger buffets that, I love having people over, and you have all these salads that are out at room temperature for 3, 4, 5, 6 hours. I mean, in my household, it's very hard for us to waste the product, but you have to understand that it's been out in these danger zones for that long, and whatever bacteria is in there has already multiplied exponentially, so it's going to increase the potential for you to get sick. Probably one of the easiest things that you can do, and we always talk about hand washing. It seems, again, so cheesy and cliche, but when you're out on your barbecue and you're running out there and you have raw chicken and you're using the tongs and you're using the tray with the raw chicken, you're putting it on the grill, everything should go back inside. If you're fortunate enough to have a sink outside, more and more people have these outdoor kitchens, so to speak.
Right.
Just hand wash, and just make sure, what we usually do is we try to use single-service utensils with larger gatherings, just because it minimizes the risk of food contamination. So
I know what I do is I bring a plate out with the chicken. I have a tin for the chicken for later.
Yes.
A tin for the beef.
Uh-huh.
But I always, I mean, my wife thinks I'm crazy.
Yeah.
Once I put the chicken on, I take the plate back in, I wash it,
absolutely,
and then I bring it back out.
Yeah, you have to.
Because even I have two separate spatulas, one for chicken, one for beef.
And actually, while you even mentioned that too, having a thermometer, and I mean, it's something. It's a $10 item that you can buy at any your local hardware store. They even have ones where you can attach it to an app, so it'll let you know when the product is cooked. It's so important that just that your temperatures are maintained, throughout.
Probably one of the worst classes I've taken in college is zoology, and you learn about all the types of bacteria that meats and foods have, and chicken is always seems to be the one that is the one you get hit with. So, as we talked previously about the shared service agreement, what's your opinion? How does it work? I mean, it's working out great for Parsippany.
Yes. Well, just a bit of a background. I'm going to try to give you like a Reader's Digest version of interlocal shared services agreements as it relates to public health. We've been doing this, we meaning the public health system, we've been doing this since the mid-'70s, where there was pretty much a need for us to share services, just because from a public health standpoint, it's very hard. There are boundaries, we know, from whether it's a governmental entity and so on, but from public health, it's very hard because we tend to cross boundaries when it comes to illnesses and outbreaks and disease investigations. So in the early 1970s, and I'm paraphrasing, there was a Uniform Shared Services and Consolidation Act that was enacted, I think, in probably '74. Again, I'm paraphrasing, and that resulted in kind of a mass shared services initiative, where I think at that time we had, and this is only in the state of New Jersey, we had 280 local health jurisdictions serving the 566 municipalities. It went from that number to probably 125 within about 6 years. Now, I mean, that's a huge initiative, and that's a tribute to the four people, to have that vision and that initiative to say, hey, listen, if we are going to do this, there has to be proper planning for the future. Now, since, let's just say, the early 80s to now, we're only down to about 90 public health departments providing services to the 565-ish municipalities. And again, that's a tribute more often to the governance component that has that willingness to say, hey, listen, this is something valuable that we can do. We also have to adhere to a 2% cap as well.
Right.
So, we're all trying to tighten our belts. We should also mention that it doesn't take away from the quality of services. It just provides us with an overarching planning and looking at the 30,000-foot view of how we provide public health services to a region, not necessarily locally, because again, public health it crosses borders, so to speak.
I know we have a public nurse at the community center on staff.
Mm-hmm.
What are the responsibilities and the duties of the nurse?
Wow. Something I'm not saying it's simple, but the communicable disease investigation component requires so much time that it's something where we're very fortunate to have, we have a full-timer and a part-timer, and they are unbelievable assets. And the key is their knowledge, whether it's something as simple as being able to utilize the portal systems, which aren't necessarily easy to use. So just having that in-house ability, and then you also have the institutional knowledge, where I think if you combine them, you have probably close to 25 years experience. It provides for a nice transition between communicating with with our merchant community, the physicians in our community, as well as our community. So I mean, it's something where, you know, we've talked about community disease investigations. We've also talked about the immunization audits, which it's something that does take a lot of time. They actually go to all the daycare centers, to the schools, but they rely on the school nurses as well to assist regarding making sure the immunization requirements are fulfilled. If not, you know, we have to make sure that they're met. It's pretty simple with that, and just making sure that we're all on the same page with minimizing the potential for disease.
Right. Now I know we have a lot of clinics, right?
Yes.
Can you?
I wish I had my list in front of me.
So you're doing good. Don't worry.
You know, it's something. I mean, we have our, and again, these are provided whether they're quarterly or semi-annual. I mean, our podiatry clinic is pretty much provided monthly. And again, if you have any questions regarding this, please feel free to go on our website, or just give us a call at 973-263-7160. We have our podiatry clinic. We also have our annual influenza clinic. We have I think it's a bi-monthly now, our child health conferences, which handles, again, all of our children that need the necessary immunizations. That also takes a lot of time for our nurses as well, because they have to report that back to the state and federal government to make sure that they have the appropriate immunizations, ordering the vaccine, making sure that they're properly stored and properly administered under a physician's, you know, order as well. We have a physician there as well. And I'm drawing a blank.
Okay, I have more questions.
You do? Right. Okay.
Well, let me ask you this question, because
yes,
you and I, we have a lot of dialogue on this. The role of the health officer when it comes to mosquito infestation and rat and. So, what is your role? I mean, I know what your role is, but explain to the residents.
Sure.
You know.
So let's start with the original, what we call the rodent issues and or nuisance issues. You know, depending on whether it's locally from resident to resident, resident to commercial, even if it's in a retail community, so to speak, you have to call us. You know, we do have a pretty sizable staff, but you know, in essence, it's anecdotal. We're not police officers where we have patrol where we're able to patrol it. We rely on the residents' eyes and ears to let us know. Once we do, we will investigate, and we will find as to who is the responsible party, and we'll provide them with education first. We're not an enforcement agent, although we do like to say that we going to court is common, unfortunately, but we provide them with some education and resources to have a favorable outcome. And from a mosquito standpoint, we're very, very fortunate to have our Morris County Mosquito Commission, which we do collaborate. I speak with the director there, the division director there, probably every week. I do get emails from them every week with updates. And we do have areas of high water table where we do have mosquito concerns. Again, please either give us a call or call the Mosquito Commission, and they're able to go out there and assess. I think we had a educational initiative that we're probably going to do again this summer in the lower Hiawatha area, where we'll go door to door and just not necessarily knock, but we have the door handle educational components just to say, hey, listen, these are a couple of things that you can do. Just try to alleviate some standing water on your property. Something as simple as a bottle cap can actually filled with water, left undisturbed for a couple of weeks, can actually promulgate mosquitoes. So it's amazing. Something that small can actually mosquitoes can actually thrive in and survive in.
Well, I'll say this: during the hurricanes, you were very instrumental with the community center. Explain the role of the health officer when we have hurricanes and we have to shelter our residents.
Yes. What we have is, and again, this is all under the Office of Emergency Management from a Preparedness Initiative, and each department and or division head is responsible for certain components, and it's one of those things where planning is absolutely vital. We do practice a lot of these plans through tabletop exercises and sometimes from a practical standpoint as well. My responsibility from a preparedness standpoint is to develop these programs. We do collaboratively throughout the state just to make sure that most of them follow specific guidelines that we receive from, again, top down, from the federal government all the way to the state and us. From a sheltering standpoint, we are responsible for maintaining that shelter. Oh, by the way, let me just let me just mention that without our volunteers, and I have to mention our CERT program, we are very, very fortunate to have an active and viable CERT program, and it just makes our job easier when they're there and you see them with the CERT shirts and the hats and say, okay, we know we have people here that are educated, that have been trained, that know how to take care of our residents. That is not an easy thing to do. It's a huge initiative under the police department and under our coordinator, and it's something that we do take great pride in this municipality, and it's something that I don't take for granted, and I realize that in a nutshell, if we needed to open up a shelter within several hours, our CERT's there.
Right, and I think we've learned from these hurricanes. I know now we have a generator.
Yes, we do.
Yeah, so.
Part of our take-home messages that we had, whether it was Irene or Sandy, we always have after-action reports, and part of those reports, communication is always a concern that we always try to better, and that usually has to do with technology. Technology is always advanced, and we try to keep up with that as well. But what we also realized is that depending on storm events, we have such a huge municipality and multiple buildings where we can shelter, but the key was the power. So and at that time it was it was you and it was our past director, who I miss greatly as well, Ms. Ivoli, mentioned. Well, we do need a generator, and I think the original was, all right, let's try and get generators for all the buildings, but from a cost prohibitive standpoint, it really wasn't. I mean, you're looking at a lot of money to operate such a large generator with these large buildings. And I think the idea came, well, why don't we provide some transfer station? Well, I think they're transfer switches at key facilities that are able to house large amounts of people in the event of sheltering. And sure enough, we were able to get a large mobile generator, but we have strategic transfer switches throughout specific buildings that are able to maintain that generator, and that generator is used for other issues as well. So it just doesn't sit there.
I know the whole health department, CERT, volunteers were very instrumental in the hurricanes. I mean, that was a trying time for Parsippany. The greatest thing is we all pulled together. We helped our residents and did the best that we could, and I think we did a fantastic job. But that being said, we're running out of time. I got to do a commercial break, but no. I want to thank you for joining us again on Pride in Parsippany, and Carlo, thank you. It's always a pleasure, you know that.
Thank you, sir.
Thank you, and everybody, God bless till next time.